Did you know that nearly 1 in 3 hospital admissions for seniors are caused by adverse drug reactions? Even more alarming, studies show that over 50% of seniors are prescribed at least one medication that could be harmful to them. And here's the kicker. Many of these medications are not rare, obscure drugs. They're everyday prescriptions you or a loved one might be taking right now. From common painkillers to heartburn remedies, the very treatments meant to help could quietly be putting seniors at serious risk. In this video, we'll uncover 13 common medications that can be toxic to seniors, and why knowing about them could literally save a life. Every point has been carefully reviewed by healthcare professionals to ensure you're getting the most accurate and life-saving information. Let's dive in, starting with one medication hiding in plain sight in almost every home. First on our list, anticholinergics. These are a class of drugs commonly found in over-the-counter allergy medications like diphenhydramine, better known under brand names like Benadryl. They're incredibly effective at stopping a runny nose, taming allergic reactions, and helping with sleep. But here's what most people don't realize. In older adults, anticholinergics don't just dry up secretions, they can dry out the brain. Research shows that regular use of anticholinergic drugs is linked to an increased risk of cognitive decline and even the development of dementia over time. Seniors may first notice something as simple as mild confusion, difficulty recalling names, or misplacing objects more often. It's easy to mistake this for normal aging, but in reality, it could be a warning sign that these medications are causing damage to critical brain functions. Another frightening aspect. Many seniors are unknowingly taking multiple medications with anticholinergic properties, stacking the risk without realizing it. This hidden danger often goes unnoticed until significant memory problems emerge. And if you think allergy meds are the only sneaky culprits affecting brain function, think again. Next up, benzodiazepines. Medications like Valium, Ativan, and Xanax are frequently prescribed to help with anxiety, sleepless nights, or even seizures. They work by depressing the central nervous system, creating a calming effect. But what's calming in younger adults can become catastrophically dangerous in seniors. Benzodiazepines dramatically heighten the risk of falls, fractures, sedation, and long-term cognitive impairment. According to several major studies, older adults on benzodiazepines are more than twice as likely to suffer from hip fractures, injuries that can be devastating and lead to a cascade of other health problems, including permanent loss of independence. What's more alarming is that benzodiazepine withdrawal is difficult and risky in seniors. Stopping these medications suddenly can cause dangerous withdrawal symptoms, meaning that once dependence begins, it can be very hard to reverse safely. And speaking of medications that affect the mind in dangerous ways, let's talk about antipsychotics. These include drugs like risperidone, Risperdal, and olanzapine, Zyprexa, often prescribed off-label to seniors who are agitated, especially those living with dementia. But despite their intended calming effect, these drugs carry a very serious warning, a black box warning from the FDA, because they significantly increase the risk of stroke and sudden death in elderly patients with dementia. Beyond that, antipsychotics can cause profound side effects, heavy sedation, extreme weight gain, tremors, and other movement disorders similar to Parkinson's disease. And the scariest part? Many seniors placed on antipsychotics for short-term agitation stay on them for years, often without regular re-evaluation. And not all dangers come from brain-affecting drugs alone. Now, we turn to muscle relaxants. Medications like cyclobenzaprine, Flexeril, are designed to reduce muscle spasms and tension. However, they act on the body in a way that's very similar to benzodiazepines, heavily sedating the nervous system. In seniors, this sedation can manifest as confusion, blurry vision, dizziness, and difficulty walking, dramatically increasing fall risks. Worse yet, muscle relaxants offer only minimal benefit for most types of chronic pain in seniors, meaning the risks almost always outweigh the rewards. Despite these risks, prescriptions for muscle relaxants in the elderly continue to rise, a concerning trend for geriatric care advocates. And if you think the risks are isolated to prescription medications, think again. Coming up next, non-steroidal anti-inflammatory drugs. This includes common over-the-counter pain relievers like ibuprofen, Advil, Motrin, and naproxen, Aleve. While millions use them for headaches, arthritis, and minor injuries, their effects on seniors can be devastating. Prolonged NSAID use has been linked to the silent development of stomach ulcers, serious gastrointestinal bleeding, kidney damage, and even dangerously elevated blood pressure. And here's the catch: damage often builds silently. A senior may feel perfectly fine right up until the moment they suffer a life-threatening bleed or their kidneys begin to fail. That's why many geriatric guidelines recommend using NSAID sparingly, and only with very close medical supervision in the elderly. Speaking of silent but deadly risks, let's move on to diabetes medications. Specifically, older medications like glyburide. While controlling blood sugar is critical, certain diabetes drugs can cause episodes of severe hypoglycemia, meaning blood sugar drops so low it leads to fainting, confusion, or even coma. Seniors are especially vulnerable because the body's ability to regulate sugar levels declines with age, and symptoms of low blood sugar, like sweating and trembling, can be blunted, making them harder to recognize. Low blood sugar episodes not only put seniors at risk of accidents but can also trigger dangerous heart rhythms or strokes. Fortunately, newer diabetes medications offer safer alternatives, but many seniors are still prescribed outdated drugs that pose unnecessary dangers. And now, another medication class that demands close monitoring. Let's talk about diuretics, commonly known as water pills. Drugs like furosemide, Lasix, help remove excess fluid from the body, which is crucial for conditions like heart failure and hypertension. However, diuretics are a double-edged sword. They can cause dehydration, dangerously low potassium levels, kidney injury, and sudden drops in blood pressure that can leave seniors dizzy, confused, or even unconscious. Even mild dehydration can significantly worsen kidney function or lead to hospitalizations in the elderly. That's why regular blood work and careful dosage adjustments are essential for any senior taking diuretics. And while we're speaking of heart-related risks, another important one, digoxin. Once a mainstay treatment for heart failure and arrhythmias, digoxin becomes particularly risky in seniors because it's processed more slowly by aging kidneys. This means the drug can accumulate to toxic levels even at normal doses. Symptoms of digoxin toxicity include nausea, vomiting, blurred or yellow-tinted vision, and confusion. More seriously, it can trigger life-threatening heart rhythms. Because the therapeutic window, the difference between an effective dose and a toxic dose, is so narrow, extreme caution is needed when digoxin is prescribed to seniors. And speaking of medications that can cause sudden, dramatic drops in blood pressure. Next, we look at alpha blockers. These drugs, like doxazosine and terazosine, are often prescribed to treat high blood pressure or prostate enlargement. However, they work by relaxing blood vessels, which can lead to dangerous orthostatic hypotension. This means when a senior stands up quickly, their blood pressure can plummet, causing dizziness or fainting. A fall triggered by fainting can result in devastating injuries like broken hips, which often have a very poor recovery prognosis in seniors. This is why alpha blockers should be prescribed with extreme caution, and with strategies in place to minimize fall risks. Moving from blood pressure to another unexpected source of danger. Let's discuss proton pump inhibitors, PPIs. These acid-reducing drugs, like omeprazole, Prilosec, and esomeprazole, Nexium, are widely used for heartburn and reflux. But prolonged use, especially without proper medical supervision, has been linked to several concerning side effects. Chronic PPI use can increase the risk of serious bone fractures by interfering with calcium absorption, trigger chronic kidney disease, and even cause vitamin B12 deficiencies, which can worsen cognitive decline and nerve problems. Despite these risks, many seniors remain on PPIs indefinitely, often long after the original problem has resolved. And while we're focusing on digestive health, laxatives deserve a mention too. Occasional use of laxatives is usually safe, but daily reliance, especially on stimulant laxatives like Senna or Bisacodil, can wreak havoc on a senior's body. Over time, the colon can become dependent on stimulation to function, leading to a vicious cycle of worsening constipation. Additionally, stimulant laxatives can cause dehydration, electrolyte imbalances, heart rhythm disturbances, and muscle weakness. Chronic laxative use without addressing the underlying cause of constipation can cause serious long-term health consequences. And finally, no discussion would be complete without addressing mood medications. Antidepressants, particularly older tricyclic antidepressants like amitriptyline, carry significant risks for seniors. While these medications were once popular for treating depression, chronic pain, or sleep disorders, they are notorious for causing sedation, blurred vision, confusion, urinary retention, and dangerously low blood pressure. Newer classes like SSRIs are generally considered safer, but even they carry some risks of bleeding, hyponatremia, low sodium levels, and falls. Each medication decision for seniors should be a highly individualized discussion, balancing mental health needs with physical safety. Final wrap-up. As we've seen, even medications that seem harmless can be dangerous when prescribed without considering the specific needs of seniors. The key is not fear, it's awareness. Never stop or change a medication on your own. Always have a full medication review with a trusted doctor or pharmacist, especially after age 60. Small adjustments can prevent major problems, and give you or your loved ones more healthy, vibrant years ahead. Because when it comes to aging well, knowledge is not just power, it's protection.